Are you someone who is always suffering from acne? Are you someone who is always suffering from painful lesions in the axilla and groin? No matter what treatment you get, you are getting boils everywhere on the body. Then watch this video. You might be suffering from hidradenitis suppurativa. Welcome to this YouTube channel. My name is Dr. Pratik. Today I'll be telling about hidradenitis suppurativa. This hidradenitis suppurativa is a chronic inflammatory condition which usually presents acne-like lesions all over the body. The patient will be having painful nodules in the axilla and the groin. These lesions will in turn lead to sinus with pus discharge and finally leading to fibro. This is a very painful condition due to which the patient is very distressed. He is not able to do his day-to-day activity, and even after multiple attempts to treat by multiple physicians, it is not getting resolved. This is the very characteristic features of hidradenitis suppurativa. So what happens in hidradenitis suppurativa is basically it is a genetic plus environmental factor. When they are both combined together, it leads to hidradenitis suppurativa. The genetic factors mutation in gamma secretase is one of the important one which discovered recently, and another environmental factors such as smoking, obesity, alcohol consumption. When all these factors come together, it will lead to hidradenitis suppurativa. The hair is the initial structure which is affected. A gland which is attached to the hair, we call it as an apocrine gland. There is inflammation of the apocrine gland, which in turn lead to inflammation and nodule formation. Initially, there is a small abscess formation surrounding this hair follicle. If this abscess is not controlled, it grows into a bigger abscess. This abscess ruptures, forming a sinus tract. And when multiple sinuses are present, they have an interconnecting channel between the sinuses, leading to fibrosis and scar. This is how the hidradenitis suppurativa based upon the amount of involvement, it is graded into 1, 2 and 3. Grade 1 being the mildest and grade 3 being the most severe. In grade 1, we'll be able to see only abscess. In grade 2, we can see sinuses plus abscess, but those sinuses are far apart from each other and they are not interconnected with each other. Whereas in grade 3, the sinuses are present closer and they are interconnected with each. This is how we grade the hidradenitis suppurativa. And there is also a scoring system for severity. There are different scoring systems. One among them is Sartorius scoring system. This scoring system becomes important because there are various modes of treatment based upon what severity the patient is. The treatment varies. In mild cases, we are giving topical antibiotics. And in moderate cases, we are going to give systemic immunomodulators, systemic or oral antibiotics. And when they are not corrected, we can go for biological agents such as adalimumab and secukinumab. Even though biologicals are a bit costly, they are having good efficacy. But before starting biologicals, there are certain blood tests which needs to be done. Only then the biologicals can be given. And this hidradenitis suppurativa is associated with other syndromes. Usually we call it as pyogenic arthritis, pyoderma gangrenosum, and acne. Along with this, hidradenitis suppurativa will have. Sometimes pilonidal sinus can also be there in a patient. These patients are very hairy people and they are more trained to develop folliculitis, abscess and nodule. And when all the treatment modalities are not working, patient is posted for surgery. All the apocrine glands which are present in the axilla or whichever the affected area is surgically removed so that they don't get involved at all. Once the patient undergoes surgery, we cannot bring him back only to the medication part, because once there is surgery and there is scarring and if the infection is not controlled, it is very tough to control. That's why surgery is always the last resort. First we try with the medication. Only if it is not getting controlled with medication and it is very severe, only then we advise surgical modalities. So thank you for watching this video. Do like, share and subscribe.